Hey there, my name is Britton. I'm an Occupational Therapy Assistant Student, and I'm here to teach you today all about the Spinal Galant Reflex. This reflex is a primitive reflex, which means it is present before birth, and it should disappear or integrate by 3 to 9 months. The Spinal Galant Reflex, Sydney, could you mind helping me for just a moment? That means when the lower back is stroked just to the side of the spine, they move towards that motion, just like that. Thanks, Sydney. So the reason why the Spinal Galant Reflex is important is because it helps the child through the birthing process. They need that hip motion to get out, you know? How it presents. So if your child still has the Spinal Galant Reflex, they can have troubles with fidgeting, balance, gait issues, trouble with concentration. There's also a strong link between the Spinal Galant Reflex and ADHD, and there can also be bedwetting. So if your child is in school with the Spinal Galant Reflex, a lot of these symptoms such as fidgeting and concentration can negatively impact their learning. So next we're going to have Sydney and Douglas come in and show some exercises for the child to help integrate the Spinal Galant Reflex.
Hi, I'm Sydney and I'm playing the role of the OTA.
And I'm Douglas and I'll be playing the role of the patient.
And we're here to give you some exercises to help integrate the Spinal Galant Reflex. First, we'll show you the snow angel. If you'll lay down on your back, Douglas. And with your arms next to your side and your legs together, that's how we want to use the starting position. And then as you bring your arms out, also bring your legs apart to do the snow angel motion. And as you continue to do this, repetition is best. You'll want to do this 10 times, 10 reps, 3 to 5 times a week, and continue doing that each week until the Spinal Galant Reflex is no longer detected by stroking their back. And you can also do this activity prone. Douglas, if you want to lay on your stomach. And doing the activity like this still integrates Spinal Galant Reflex, but it also helps with trunk control. Another valuable activity that you can do to exercise the Spinal Galant Reflex is a bear crawl. It's a little bit different than the traditional bear crawl, which would be walking hand, foot. With our bear crawl, you walk hand, foot, and walk your feet to your hands to create the look of the bear crawl. Douglas, if you can do that for me on your hands and feet, and walk your feet to your hands. And then move your hands forward, and walk your feet to your hands again. This is really good to be done in repetition, so doing about 10 to 15 reps 3 to 5 times a week is really beneficial. You would also continue, just like the snow angels, doing this exercise until the Spinal Galant Reflex is completely integrated.